several different segmentation softwares out there. So right now, say if unfortunately you had to go in and get a scan for some reason, and whether it was through a CT or an MRI scan, that collects what we call your patient DICOM data. It's a digital data set from your actual scan. There are softwares out like Siemens software, maybe like a Materialize, a Synopsys. There's companies out there where you could take that DICOM data set and convert it into a 3D printable model. And within that model, similar to like this part I showed you, different aspects of your anatomy. So if it was like your chest again, your rib cage, your heart, your spine, everything is almost set as a separate model. What sometimes in the 3D printing world, people talk about STLs a lot. That's probably the easiest way to explain it. You're creating almost separate STL files for each component of your body that got scanned. That today we utilize a lot with our digital anatomy printers, or really just all of our PolyJet printers, to create patient-specific models. Surgeons will use them for practicing before a surgery. They'll use them for training and education with residents. They'll also use it with training of a patient. Why are you going through this procedure? How are we going to go about it? And today, based on what software you use to segment your DICOM data set, if you utilize one of our PolyJet systems, you're getting a one-to-one match of your scan to the printed file. So not only can it be used for training, but it can also be used for what we consider diagnostic, for actual diagnostics of what might be wrong with the patient or how we plan to go through this next surgery.
It's really amazing. So, how does the ability to replicate those fine anatomical details influence the development and testing of like implantable devices or diagnostic tools?
I think the biggest is, so when you take, let's say, a cadaver, as much as that fully is mimicking a patient's anatomy, it is only one specific patient at that time. You don't know if they had any of the deformities that you're looking to scan for. So this is really helping when it comes to training and teaching of how to make sure that all X-ray techs, CT techs are understanding what to help look for, where they might need to tune in a scan. And that also helps that if as a patient, you had to come in for a CT scan, first time around, everything was captured properly. Then no one ever comes back and say, we didn't get a clear enough image, or someone needs to come back, or we had to tune the machine a little bit. So I feel like this is truly helping the hospital experience, not only for the surgeons that are hoping to look through your scan and data, but also the patients that are going to be going through this experience. So we may not fully feel it directly, but I think the idea is that we hear it from our customers, how much it's improved that training process.
So, looking ahead, what future innovations or improvements do you foresee in radiopaque 3D printing materials that could further benefit medical device design and testing?
I think one that you hit on earlier that's large is being able to save in the cadaver space. I mean, we all know that cadavers and the use of them is not going to go away. It is definitely a necessary training step. But if there's ways to mitigate when they're needed, how often they're needed, being able to obtain them, everyone being clean in use of them, being able to dispose them. I mean, that's a big process in and amongst itself. So if we're able to have a part in that of saving on cost, saving on needs, being able to take something that's just in an open desk forum to test out, and anyone can handle in their process, I think is a big portion to that we're hopeful to kind of take a chunk in that space. As I mentioned before, just the constant training and teaching. Anyone that would like to go through being a CT technician or an X-ray tech, it's, a chance to get better training and education within these tools. And we hope that these tools and these models will create a more of a variety for learning and understanding how the different equipment works without always having to rely on one very expensive phantom tool or even going through the cadaver experience.